Question 1. Human Resources Management. A veterinary practice is experiencing high employee turnover. As the practice manager, which approach would most effectively address this issue? A. Offering higher salaries to all employees without addressing workplace issues. B. Conducting exit interviews to identify recurring themes and patterns. C. Avoiding discussions about turnover to maintain team morale. D. Hiring additional staff to compensate for employee departures. Answer. B. Conducting exit interviews to identify recurring themes and patterns. Explanation. High employee turnover often indicates underlying issues such as poor workplace culture, lack of career growth opportunities, or unaddressed conflicts. Conducting exit interviews helps identify recurring problems and allows management to implement targeted solutions. Offering higher salaries alone, option A, may not address non-financial concerns such as job satisfaction or work-life balance. Avoiding discussions, option C, ignores the root causes and risks further dissatisfaction. Simply hiring more staff, option D, without addressing the issues perpetuates the cycle. Relevant law guidelines, employee retention strategies, and OSHA's focus on workplace safety and well-being emphasize proactive identification, resolution of workplace concerns. Question 2. Scenario-based law and ethics. Dr. Thompson, a veterinarian, discovers that an employee has been mishandling controlled substances in violation of deregulations. What is Dr. Thompson's most appropriate course of action? A. Confront the employee and ask them to resign immediately. B. Ignore the issue to avoid negative publicity for the practice. C. Report the incident to the D and ensure compliance protocols are reviewed. D. Transfer the employee to non-drug related role without further investigation. Answer. C. Report the incident to the D and ensure compliance protocols are reviewed. Explanation. Deregulations require that any suspected diversion of controlled substances be reported promptly. Reporting ensures legal compliance and mitigates risks associated with drug misuse. While confronting the employee, option A, might be necessary, it does not satisfy legal reporting requirements. Ignoring the issue, option B, is a violation of federal law and could result in severe penalties for the practice. Transferring the employee, option D, without addressing the problem risks perpetuating misconduct and liability. Reviewing compliance protocols ensures preventive measures are in place. Relevant law guidelines. D. Guidelines for controlled substances, including proper handling, record keeping, and mandatory reporting of violations. Question 3. Financial management. A veterinary practice is struggling with cash flow issues despite steady revenue. Which of the following strategies is most effective for addressing this problem? A. Increasing the prices of all services immediately to boost income. B. Implementing stricter accounts receivable policies to improve collections. C. Reducing marketing expenses to conserve cash. D. Halting inventory purchases to limit outgoing cash flow. Answer. B. Implementing stricter accounts receivable policies to improve collections. Explanation. Cash flow problems often arise from delays in collecting payments even when revenue is steady. By tightening accounts receivable policies, such as requiring upfront deposits or reducing credit terms, practices can improve cash flow without risking client relationships. Increasing prices, option A, may lead to client dissatisfaction if not communicated. Cutting marketing expenses, option C, can hinder long-term growth by reducing client acquisition. Halting inventory purchases, option D, risks compromising service delivery and patient care. Relevant law guidelines. Best practices for financial management in veterinary practices emphasize efficient revenue cycle management, including timely collections and strategic expense control. Question 4. Leadership and professional development. As a practice manager, you notice a decline in team productivity and morale. Which leadership strategy is most effective for addressing this issue? A. Implementing strict performance monitoring and disciplinary measures. B. Hosting regular team meetings to discuss concerns and provide support. C. Offering financial bonuses without addressing the underlying issues. D. Avoiding direct intervention to allow the team to self-correct. Answer. B. Hosting regular team meetings to discuss concerns and provide support. Explanation. Engaging with the team through regular meetings fosters open communication, allows employees to voice concerns, and provides an opportunity to collaboratively develop solutions. Strict monitoring and discipline, option A, may worsen morale. Financial bonuses, option C, can temporarily boost motivation but fail to address long-term issues. Avoiding intervention, option D, risks further productivity decline and employee dissatisfaction. Relevant guidelines. Situational leadership theory emphasizes adaptability and fostering collaboration to improve team dynamics and performance. Question 5. Marketing and client relations. Which client communication strategy is most effective for increasing compliance with preventive care recommendations? A. Sending automated reminders about upcoming appointments and vaccinations. B. Relying on clients to research preventive care information themselves. C. Limiting communication to face-to-face interactions during visits. D. Using medical jargon to emphasize the importance of services. Answer A. Sending automated reminders about upcoming appointments and vaccinations. Explanation. Automated reminders ensure clients stay informed about their pet's health needs, reducing missed appointments and improving compliance. Relying on clients to self-research. Option B. Risks misinformation. Limiting communication to in-person interactions. Option C. Misses opportunities for ongoing education. Using medical jargon. Option D. Confuse clients and reduce engagement. Relevant guidelines. Effective client communication strategies in veterinary practices emphasize clarity, accessibility, and proactive engagement. Question 6. Scenario-based operations management (MS). Patel, a practice manager, is implementing a new scheduling system to improve workflow efficiency. Several staff members resist the change, citing concerns about increased workload. What is the best approach for MS Patel to handle this situation? A. Mandating the system change without addressing staff concerns. B. Offering an incentive program for staff who adopt the new system quickly. C. Holding a team meeting to explain the benefits and gather feedback. D. Delaying the implementation until all staff are fully on board. Answer. C. Holding a team meeting to explain the benefits and gather feedback. Explanation. Transparency and collaboration are key to managing change. Explaining the rationale for the new system and addressing staff concerns fosters buy-in and reduces resistance. Mandating the change. Option A. Risks damaging morale. Incentivizing adoption. Option B. May encourage participation but fails to address the root concerns. Delaying implementation. Option. Install necessary improvements and prolong inefficiencies. Relevant guidelines. Change management strategies highlight the importance of communication, stakeholder involvement, and gradual implementation for successful adoption of new processes. Question 7. Financial management. What is the most effective way to manage inventory costs without compromising patient care? A. Ordering large quantities to reduce unit costs regardless of storage capacity. B. Implementing an inventory turnover system to track and reorder items efficiently. C. Reducing inventory levels to the bare minimum to save on costs. D. Purchasing items based solely on manufacturer promotions. Answer. B. Implementing an inventory turnover system to track and reorder items efficiently. Explanation. An inventory turnover system ensures that supplies are restocked based on usage patterns, minimizing waste and avoiding overstocking while maintaining necessary items for patient care. Bulk orders. Option A. Can lead to storage issues and increased costs. Minimizing inventory. Option C. Risks running out of critical items. Promotions. Option D. May result in unnecessary purchases and inefficient resource use. Relevant guidelines. Best practices for inventory management in veterinary clinics emphasize turnover tracking and cost-effective purchasing aligned with patient needs. Question 8. Strategic planning. We're planning for the expansion of a veterinary practice. Which step is most critical for ensuring long-term success? A. Securing a loan without conducting a market analysis. B. Evaluating client demographics and competition in the target area. C. Prioritizing the purchase of the most advanced medical equipment. D. Relying on existing staff to handle increased workload. Answer. B. Evaluating client demographics and competition in the target area. Explanation. Market analysis provides essential data on potential demand, competition, and client needs, informing strategic decisions about location and services. Securing a loan. Option A. Without research risks financial losses. Advanced equipment. Option C is valuable but should align with identified demand. Relying solely on current staff. Option. Risks burnout and inefficiencies. Relevant guidelines. Strategic planning frameworks emphasize market analysis and resource allocation for sustainable growth. Question 9. Law and ethics. Which of the following actions aligns with the AVMA Code of Ethics when handling client complaints? A. Dismissing the complaint without investigating the issue. B. Providing a detailed explanation of the incident and proposed resolution. C. Referring the client to legal counsel instead of addressing the concern. D. Offering a refund without investigating the validity of the complaint. Answer: B. Providing a detailed explanation of the incident and proposed resolution. Explanation: the AVMA Code of Ethics promotes transparency and accountability. Addressing complaints with a clear explanation and resolution demonstrates professionalism and builds client trust. Dismissing the complaint, option A, or referring clients to legal counsel, option C, avoids accountability. Offering refunds, option D, without investigation can set a harmful precedent. Relevant guidelines: the AVMA Code of Ethics emphasizes integrity, accountability, and client communication in veterinary practices. Question 10. Regulatory and environmental management. Which practice is essential for maintaining compliance with medical waste disposal regulations? A. Storing hazardous waste in the same area as regular trash. B. Using approved containers for shops and biohazard materials. C. Disposing of expired medications in regular waste bins. D. Allowing staff to dispose of medical waste based on personal judgment. Answer: B. Using approved containers for shops and biohazard materials. Explanation: approved containers are critical for preventing contamination, injury, and regulatory violations. Storing hazardous waste with regular trash, option A, risks contamination. Disposing of expired medications in regular bins, option C, violates environmental laws. Allowing personal judgment, option D, leads to inconsistent compliance. Guidelines: OSHA and EPA regulations require proper segregation, labeling, and disposal of medical waste to ensure safety and compliance. Question 11. Client education. What is the most effective way to educate clients about a new wellness program for their pets? A. Posting flyers in the clinic without additional explanation. B. Offering the detailed explanation during appointments and answering questions. C. Including program details in the billing statement without prior discussion. D. Relying on social media posts as the sole method of communication. Answer: B. Offering a detailed explanation during appointments and answering questions. Explanation: face-to-face communication ensures clients fully understand the wellness program and have the opportunity to ask questions. Flyers, option A, or billing statements, option C, lack engagement, while relying solely on social media, option D, may not reach all clients. Relevant guidelines. Client education best practices emphasize engagement and addressing individual concerns. Question 12. Staff training. How can a practice manager ensure that new staff members are effectively trained on clinic protocols? A. Assigning them to shadow experienced staff without formal training. B. Providing a comprehensive training manual and scheduled evaluations. C. Allowing new hires to learn through trial and error. D. Focusing only on areas where mistakes are made. Answer: B. Providing a comprehensive training manual and scheduled evaluations. Explanation: a structured training program with clear guidelines and evaluations ensures that staff members understand protocols and can perform their duties effectively. Shadowing alone, option A, or trial and error learning, option C, can lead to inconsistencies. Focusing only on mistakes, option D, is reactive rather than proactive. Relevant guidelines. Effective onboarding includes a combination of written materials, hands-on training, and regular assessments. Question 13. Conflict resolution. A client is upset about a miscommunication regarding their pet's treatment plan. What is the best way for staff to resolve the conflict? A. Interrupting the client to explain why they are mistaken. B. Listening to the client's concerns and offering sincere apology. C. Referring the client to another clinic to avoid further issues. D. Escalating the issue to legal team immediately. Answer: B. Listening to the client's concerns and offering sincere apology. Explanation: active listening and acknowledging the client's feelings help de-escalate the situation and rebuild trust. Interrupting the client, option A, is disrespectful. Referring the client elsewhere, option C, avoids resolution, and escalating to legal team, option D, is unnecessary in most cases. Relevant guidelines. Conflict resolution strategies emphasize empathy, communication, and finding solutions that prioritize client satisfaction. Question 14. Time management. What is the most effective way for a practice manager to prioritize tasks during a busy day? A. Addressing the easiest tasks first to reduce workload quickly. B. Focusing on tasks based on urgency and importance. C. Delegating all tasks to available staff members without oversight. D. Handling tasks in the order they were received. Answer: B. Focusing on tasks based on urgency and importance. Explanation: prioritizing tasks based on urgency and importance ensures that critical issues are addressed promptly while managing time effectively. Completing easy tasks first, option A, may leave important issues unresolved. Delegation, option C, requires oversight and handling tasks in order of receipt. Option D does not consider their significance. Relevant guidelines. Management frameworks like the Eisenhower Matrix emphasize evaluating tasks for both urgency and importance. Question 15. Risk management. What is the best way for a veterinary practice to minimize the risk of liability claims? A. Keeping detailed and accurate medical records for all patients. B. Reducing the time spent documenting patient interactions. C. Limiting client access to their pet's medical records. D. Avoiding discussion of potential risks associated with treatments. Answer A. Keeping detailed and accurate medical records for all patients. Explanation: thorough documentation ensures clarity, accountability, and legal protection in case of disputes. Reducing documentation time. Option B risks missing important details. Limiting client access. Option C can erode trust, and avoiding discussions of risks. Option D fails to meet informed consent requirements. Relevant guidelines. Risk management. Veterinary practices prioritizes transparency, communication, and meticulous record keeping. Question 16. Employee retention. Which strategy is most effective in retaining highly skilled veterinary staff in a competitive job market? A. Offering competitive salaries and comprehensive benefits packages. B. Conducting annual performance reviews without additional feedback. C. Delegating challenging tasks without offering support or guidance. D. Focusing on hiring replacements instead of retention efforts. Answer A. Offering competitive salaries and comprehensive benefits packages. Explanation: competitive salaries and benefits demonstrate that the organization values its staff, leading to increased job satisfaction and retention. Annual reviews without ongoing feedback. Option B. Lack engagement while delegating tasks without support. Option C causes frustration. Prioritizing replacements. Option D is reactive and costly. Relevant guidelines. Employee retention strategies should focus on fair compensation, professional development, and positive workplace culture. Question 17. Controlled substances compliance. A veterinary clinic discovers that its controlled substances inventory count does not match its records. What is the best course of action for the practice manager? A. Adjusting the records to match the current inventory. B. Investigating the discrepancy and reporting is required by the D. C. Ignoring the issue if the discrepancy is small. D. Restricting all staff access to controlled substances indefinitely. Answer B. Investigating the discrepancy and reporting is required by the D. Explanation: D. Regulations require that any discrepancies in controlled substances inventories are promptly investigated and reported. Adjusting records. Option A without explanation is illegal. Ignoring the issue. Option C is non-compliant, and restricting all staff access. Option D may disrupt operations unnecessarily. Relevant guidelines. Controlled Substances Act CSA mandates rigorous tracking, reporting, and security measures for handling controlled substances. Question 18. Marketing strategies. What is the most effective way to measure the success of a digital marketing campaign for a veterinary practice? A. Monitoring website traffic, social media engagement, and client conversions. B. Reviewing only the number of likes on social media posts. C. Using feedback from staff without analyzing marketing metrics. D. Assuming success if client volume remains constant. Answer A. Monitoring website traffic, social media engagement, and client conversions. Explanation: tracking multiple metrics, such as website traffic, engagement, and client conversions, provides a comprehensive understanding of a campaign's effectiveness. Focusing solely on social media likes. Option B lacks depth, while relying on staff feedback alone. Option C is subjective. Assuming success without data. Option D is ineffective. Guidelines. Effective digital marketing strategies require measurable goals and data-driven analysis to evaluate success. Question 19. Scenario question. Client complaint. Dr. Patel's veterinary clinic receives a complaint from a long-term client, Mr. Larson, who feels overcharged for a recent procedure. After reviewing the bill, Dr. Patel confirms that the charges align with the clinic's pricing policy. What is the best way for the practice manager to handle this situation? A. Apologize to the client and issue a full refund immediately. B. Provide a detailed explanation of the charges and offer to discuss further. C. Ignore the complaint since the charges are correct. D. Inform the client that complaints about pricing are not welcome. Answer: B. Provide a detailed explanation of the charges and offer to discuss further. Explanation: clear communication about pricing policies combined with a willingness to discuss concerns helps maintain trust and client satisfaction. Offering a refund option A without cause undervalues the clinic's pricing policy. Ignoring the complaint option C damages the relationship, and dismissing feedback option D is unprofessional. Relevant guidelines: client complaint resolution emphasizes transparency, empathy, and maintaining professional integrity. Question 20. Financial management. What is the most critical factor to consider when setting fees for veterinary services? A. The average fees charged by competitors in the same area. B. The clinic's operating costs, desired profit margin, and value provided to clients. C. Setting fees lower than competitors to attract more clients. D. Using historical pricing without adjustments for inflation or costs. Answer: B. The clinic's operating costs, desired profit margin, and value provided to clients. Explanation: fees should reflect the clinic's costs, desired profitability, and the value offered to clients. While competitor pricing, option A, is useful for benchmarking, it should not solely determine fees. Setting prices too low, option C, undermines profitability, and relying on outdated pricing, option D, fails to account for finer changes. Relevant guidelines: effective fee setting balances financial sustainability with client affordability and service value. Question 21. Employee onboarding. What is the most effective way to ensure a new veterinary technician integrates successfully into the clinic team? A. Assign them to observe without any formal training for the first month. B. Provide a comprehensive onboarding plan with mentorship and regular check-ins. C. Allow them to self-train by following their experienced colleagues. D. Focus solely on administrative tasks for the first few weeks before clinical training. Answer: B. Provide a comprehensive onboarding plan with mentorship and regular check-ins. Explanation: effective onboarding involves structured training, clear expectations, and consistent feedback, enabling new hires to acclimate quickly and feel supported. Observation without training, option A, lacks engagement. Self-training, option C, risks inconsistencies and delaying clinical training. Option D, hinders immediate skill application. Guidelines: best practices in onboarding include tailored training plans, regular feedback, and fostering a positive workplace culture. Question 22. Ethical decision-making. A client requests that a veterinary practice falsify a vaccination record to meet housing requirements for their pet. What should the practice manager do? A. Explain the clinic's policies and refuse the request. B. Fulfill the request to maintain client satisfaction. C. Refer the client to another veterinary clinic without addressing the issue. D. Ignore the request and proceed with regular services. Answer: A. Explain the clinic's policies and refuse the request. Explanation: falsifying records violates professional ethics and legal standards, jeopardizing the clinic's integrity. Referring the client, option C, or ignoring the request, option D, avoids accountability, and complying, option B, is unethical and unlawful. Relevant guidelines: AVMA Code of Ethics mandates honesty and transparency in all professional dealings. Question 23. Scenario question: inventory management. At Dr. Chang's clinic, the monthly inventory report shows consistent overstock of non-essential items, while critical supplies frequently run out. What should the practice manager do to improve inventory management? A. Reduce inventory tracking to save time and focus on other priorities. B. Implement an inventory control system that tracks usage trends and restocking needs. C. Purchase only small quantities of all items, regardless of their usage. D. Delegate inventory decisions entirely to staff without oversight. Answer: B. Implement an inventory control system that tracks usage trends and restocking needs. Explanation: an inventory control system helps optimize stock levels, preventing overstocking or shortages. Reducing tracking, option A, exacerbates issues. Purchasing small quantities, option C, leads to inefficiencies. And delegating without oversight, option D, risks mismanagement. Relevant guidelines: effective inventory management rely regular analysis, accurate tracking, and strategic purchasing decisions. Question 24. Financial forecasting. We're preparing a financial forecast for the next fiscal year. Which factor should be given the highest priority? A. Historical performance data and market trends. B. Predictions about the local economy without supporting data. C. Personal goals of the practice owner regardless of feasibility. D. Avoiding any adjustments to current revenue and expense patterns. Answer A. Historical performance data and market trends. Explanation. Forecasting based on reliable historical data and industry trends ensures realistic and data-driven financial planning. Predictions without data. Option B. Are speculative. Personal goals. Option C. Must align with feasibility and avoiding adjustments. Option D. Ignores potential growth or challenges. Relevant guidelines. Financial forecasting should balance historical insights with market conditions and strategic goals. Question 25. Client retention. What is the best way to increase client retention in a veterinary practice? A. Offer loyalty programs and personalized client experiences. B. Focus exclusively on acquiring new clients. C. Provide services without explaining their value to clients. D. Avoid responding to client feedback to minimize operational distractions. Answer A. Offer loyalty programs and personalized client experiences. Explanation. Retention strategies like loyalty programs and personalized care foster long-term client relationships. Prioritizing new clients. Option B. Over existing ones can increase churn while failing to communicate value. Option C. And ignoring feedback. Option D. Erodes trust and satisfaction. Relevant guidelines. Client retention is built on exceptional service, value, and engagement with existing clients. Question 26. Legal compliance in employment. Which of the following is an employer's responsibility under the Occupational Safety and Health Administration (OSHA) regulations in veterinary practice? A. Provide protective equipment only to employees in high-risk roles. B. Ensure employees receive safety training relevant to their tasks and roles. C. Allow employees to handle hazardous materials without formal training. D. Rely on employees to identify safety risks independently. Answer. B. Ensure employees receive safety training relevant to their tasks and roles. Explanation. OSHA requires employers to provide a safe working environment, including appropriate training and protective equipment for all relevant tasks. Limiting protective equipment. Option A. Or training. Option C is non-compliant, relying solely on employees to identify risks. Option D shifts responsibility improperly. Relevant guidelines. Standards mandate proper hazard communication, training, and provision of personal protective equipment, PP. Question 27. Handling ethical dilemmas. A client accuses a veterinary assistant of mishandling their pet during a procedure. What is the most ethical and effective way for the practice manager to address the situation? A. Dismiss the client's concern as misunderstanding. B. Investigate the complaint, gathering statements from both the client and the staff involved. C. Apologize to the client without discussing the complaint with staff. D. Terminate the assistant immediately to avoid further complaints. Answer. B. Investigate the complaint, gathering statements from both the client and the staff involved. Explanation. Ethically, complaints should be thoroughly investigated to ensure fairness and accountability. Dismissing concerns. Option A. Disregards the client's experience while apologizing without investigation. Option C. Undermines due process. Immediate termination. Option D. Without evidence is unfair and potentially unjustified. Relevant guidelines. AVMA principles emphasize fairness, transparency, and addressing complaints professionally. Question 28. Scenario question. Marketing and client education. MS. Patel has recently adopted a high-energy dog with specific dietary and exercise needs. During her visit, she expresses confusion about proper care and asks for guidance. How should the veterinary team approach this situation? A. Provide MS. Patel with a general brochure on pet care and recommend further online research. B. Offer a personalized consultation addressing her dog's unique needs and follow up with educational resources. C. Suggest she enroll in an advanced obedience course before addressing her concerns. D. Advise her to wait until a dog exhibits issues before seeking additional guidance. Answer. B. Offer personalized consultation addressing her dog's unique needs and follow up with educational resources. Explanation. Personalized consultations ensure MS. Patel receives accurate, relevant information to address her pet's specific needs. General brochures, option A, lack customization. Advanced obedience courses, option C, may not address her immediate concerns and waiting for issues to arise. Option D is reactive. Proactive, relevant guidelines. Effective client education involves tailored advice, clear communication, and proactive care planning. Question 29. Strategic business growth. What is the most effective first step when planning to expand a veterinary practice by adding a new location? A. Conduct a thorough market analysis of potential areas for expansion. B. Hire staff immediately to be ready when the new location opens. C. Purchase property in a high traffic area without considering local demand. D. Assume that current operational procedures will work seamlessly in the new location. Answer A. Conduct a thorough market analysis of potential areas for expansion. Explanation. Market analysis helps identify demand, competition, and feasibility, ensuring a data-driven approach. Hiring staff prematurely. Option B. Risks inefficiencies while property purchases. Option C. Without demand assessment can lead to poor ROI. Assuming existing procedures will suffice. Option D. Overlooks local nuances. Relevant guidelines. Strategic planning must include SWOT analysis, competitive evaluation, and alignment with the practice's mission. Question 30. Conflict resolution in the workplace. Two veterinary assistants frequently argue during shifts, causing tension among the team. What is the best way for the practice manager to address this issue? A. Ignore the conflict, assuming it will resolve naturally. B. Meet with the assistants individually to understand their perspectives and mediate a solution. C. Reassign one assistant to a different shift without discussing the conflict. D. Publicly reprimand both assistants to discourage further disagreements. Answer B. Meet with the assistants individually to understand their perspectives and mediate a solution. Explanation. Mediation fosters understanding and collaboration while addressing the root causes of the conflict. Ignoring the issue. Option A. Or reassigning staff. Option C. Avoids resolution and public reprimands. Option D. Can escalate tension and reduce morale. Relevant guidelines. Effective conflict resolution involves active impartiality and fostering a positive workplace culture.